Hello and welcome to another edition of Health Matters on Channels Television. Thanks for joining us. A very interesting edition, I might add. I am Mary Alale Yusuf. The World Health Organization puts the number of under 5 deaths in 2015 at 5.9 million globally. More than half of this number could have been prevented or treated with access to simple interventions. Children in sub-Saharan Africa are 14 times more likely to die than those in developed countries. And almost all maternal deaths occur there, that is in sub-Saharan Africa. Now, the MTN Foundation is partnering with JNC International Limited, a medical equipment solutions company, to bring down the numbers in Nigeria, and we'll tell you how. My guest is Clare Omatseye. She is a pharmacist, founder and CEO of JNC, a senior fellow of the Nigeria Leadership Initiative, and pioneer president of Healthcare Federation of Nigeria. Glad to have you, Clare.
Thank you.
So what's this about, MTN, JNC? How are we bringing down these numbers?
Okay, as you know, MTN has a fantastic foundation that has done a lot of things for the country. And one of their particular pet projects is to start the maternal ward project. And with this, we're able to start tackling some of the challenges of the society right now with, terrible statistics for maternal and child death.
Oh, yes. Even though they do say they've come down, but they still say that the numbers are way too high.
Absolutely. I mean, every single day we lose 2,300 children under 5 in this country.
In Nigeria?
In this country.
The number again?
2,300 children under 5, in addition to 145 women of childbearing age on a daily basis. I mean, this is really alarming. And these statistics are something that we, in partnership with MTN Foundation, think that we can be able to intervene and start to work with the government, collaborate with the government through a public-private partnership to tackle these numbers.
Okay, so it's MTN and the government. How exactly are you going to get this done?
Okay, MTN had a competitive bid, and they chose JNC as their technical partner.
Congratulations.
Thank you very much. And then over the years, we've partnered with MTN in different ways. But this particular pet project was something that was very special to their hearts. Seeing and hearing the hardship of women, losing their babies on a daily basis, women dying, is something that I think was very dear. And so this pet project is something that immediately we were called on board. They told us exactly what we wanted to do, and we put a plan together. And this plan was first to identify what the issues were, and some of those were the facilities. The facilities in the country were not up to par. Secondly was the quality of the equipment, and third was the training of the medical staff, in the various locations.
So you're partnering with MTN in all these 3 areas?
Absolutely, absolutely. So we are the technical partner to MTN Foundation. Our job is to make sure we do the renovation of 24 hospitals, maternal centers across the country in 6 of the geopolitical zones. We've started already with 7 in 2 states already.
Okay.
And in the next 4 weeks, we should actually be handing these over to some of the states.
Great. I hope we get to see that. So these hospitals, just give me a rough idea of what are the kind of facilities the moms and the children should be expecting.
Okay. The first is that we've taken each of the states. For each of the states, we're going to do 4 hospitals in each of the states. By the time we finish, you're going to have a modern ward, all totally renovated with new equipment, brand new beds, with everything that is required for privacy and single patient. At the same time, we're also going to have a special care baby unit for 2 babies, and this will now really help with this issue of maternal and child death. So.
Okay, now let's come down to brass tacks. How about the cost to mothers and children? What's that going to be like?
Okay, one of the things when we were looking for partners, one of the things that we did was we had an expression of interest, and we asked all intending states that were interested in partnering with us to have an expression, and they did this. And one of the things we told them that was important was sustainability. So we were looking for like-minded partners that were not just about, equipment is great. And
expensive.
Yes, and great, but it doesn't make it happen. What really makes it happen is people. So we needed to make sure that for each of the states that we were partnering with, that the hospitals, the medical directors, the state governments, the commissioners were all totally committed. And I must say, in the 6 states that we've chosen as the first beneficiaries, we found people that were very determined to reversing the negative trends of maternal and infant mortality. And part of their contribution was also to make sure the sustainability. So we have proper water, we have proper power supply, we have the consumables that are guaranteed. They're going to join us in awareness creation, getting people to come into the various hospitals, have safe deliveries, getting more people to have their babies.
Tell us we're not going to run out of water in these hospitals.
Absolutely not.
Okay, 6 states. What are these 6 states?
Okay, the first 2, we started with Sokoto, so Sokoto and Oyo, and then we're now moving on to Kaduna and then Niger, and the last would be Abia and Cross River. Those are the first 6 states.
We understand that most of the deaths we talk about are contributed by the northern states. So why Abia and Cross River?
Well, as a foundation, all Nigerian lives count, and therefore we've made that, from day one we wanted to make sure we could have as many states that would qualify from each of the 6 geopolitical zones. Having said that, there are 3, as you can see, from the northern part of Nigeria. Yes, the statistics are a lot higher. I mean, it is alarming because when I mentioned at the beginning the statistics, we are the 2nd largest contributor to under 5 mortality and maternal mortality in the world. And therefore it's very important that we tackle where, the biggest challenges.
Where the problem really is. But then, even though those are the biggest contributors to the maternal and child mortality rates, you're getting a bit of some of that from everywhere, all over the country.
That's correct.
Is this going to be spread over time to other states, or is this the size of it?
I wouldn't want to speak on behalf of MTN Foundation, but I do know that the intention is to take this further. So yes, we are starting with the first 6 states, and I'm sure there will be another phase thereafter. But for now, if we are able to tackle the first 24 hospitals, just be able to provide world-class services with modern equipment, with excellent after-sales service to make sure that the equipment is well used, great collaboration with the state governments on awareness and just keeping people coming into the hospital. I think that we'll be able to start to reverse those trends. Okay.
Now, we understand your intention, MTN's intention, but there seems to be a stronghold. I call it a stronghold because, mothers, families feel that no matter how available the equipment is, the hospitals are, they feel it's too expensive for them. How are we breaking that jinx? Is it going to be free for them? Are they going to pay a token? And how do we get them to know that this is available for them?
Okay, let's start first, but how do you put a value on life? What is the value of life? First, we must have, and what we want to be able to partner with the government to do, is to provide access to good quality healthcare.
Okay.
We want to make sure it is affordable, and we want to make sure it's sustainable. And we believe that through this partnership, through the MTN Foundation and these various state governments, that we've found a formidable solution. Affordability is relative. We are not going to increase the cost because we've provided new equipment. We're actually subsidizing the cost. And I think that the state governments have also given a commitment to continue to provide, some of the state governments are providing free services, some will provide subsidized services. But it is a collaborative effort to make sure that people are more aware and come in and have safe delivery. And we really can put a value on life.
Now, I wish you the very best.
Thank you.
We have to bring down those numbers. Thank you so much, Claire, for coming.
You're most welcome. Thank you very much,
We'll take a break right now. When we come back, something else.